So bispecific antibodies are a very interesting class of drugs. They're an antibody which bring together the T cell, usually targeting CD3, with the B cell, usually targeting CD20. There are a number of bispecific antibodies in development, both in high grade and low grade, things like Mosunetuzumab, Bispecific, Epcoritamab, Odronextamab. So there's a whole suite of these drugs being developed. Relapsed refractory follicular is a very interesting sort of area to look into these medicines. We know that follicular lymphoma, as patients relapse, their remission duration reduces. And to be honest, once you've got through 2 lines of chemotherapy and perhaps lenalidomide and rituximab, there's not really any good standard treatment options out there. So there is an area of unmet need. It's not a huge number of patients, but we really do need to address that need. And bispecific antibodies, no matter which one really you look at, have really quite a high overall and complete response rate in that setting. Now that's with monotherapy, and we've had some approvals. So Mosunetuzumab, for example, has been approved in relapsed refractory follicular in Europe. We've had some approvals, but I think what many people are interested in now is looking at combination studies, and the natural combination partner, I think, is lenalidomide. So the idea there is lenalidomide is an immunomodulatory drug. It sort of peps up your T cell, and then your bispecific brings that more active T cell to the lymphoma cell. So this combination of lenalidomide bispecific is being explored certainly with Mosunetuzumab and Epcoritamab, a number of different bispecific antibodies, often as in the context of randomized trials. So I think that's going to be great, because it's all very well having single-arm phase 2 data, but what we really need, particularly for reimbursement, in various countries around the world, is good randomized data showing a benefit by adding the bispecific antibody.